TIA is the transient ischemic attack. This is a neurological symptoms that appear and completely disappear less than 24 hours in majority of the cases. Symptoms start resolving by first hour itself. Therefore, the imaging to be normal and fibrinolytic system disintegrate the clot. The main features are ophthalmic artery involvement is most common, that is transient onset blindness, and also we see the amorphous fugae due to involvement of middle cerebral artery involvement. There is arm weakness, facial weakness, or aphasia. There is also anterior cerebral artery involvement, the patient having paresis. Then also vertebral artery involvement, the patient having nasal regurgitation of fluid, that is nine nerve involvement, and pin and needle sensation. In that we see the ABCD score used to predict chance of development stroke, that is maximum score in that the 7. The first A for age is 60 year. We uh, give for this point is score 1 score. For B for BP, that is more than 140 by 90, and C for clinical feature, that is arm weakness. We give for this is score 2. Fourth one is A for aphasia, we score 1, and for D for duration is less than 10 minutes, we score 0, and for 10 to 51 we score 1. For more than 60 minutes is 2. Then a second D is for diabetes mellitus, yes or no. If yes, then we score 1, or if no, there we score 0. That the symptoms that suggestive of TIA or stroke. That first one is sudden onset of facial weakness, then arm weakness, then third one is speech difficult, then fourth one is time delay implies maximum damage to neurons. Then how to investigate this patient? Then we on ECG rule out atrial fibrillation, and in atrial fibrillation if clot present, then cardiomyolism, there is chance of cardiomyolism. Then TTE or TE rule out the mural thrombus, or for carotid artery Doppler to rule out the atherosclerotic narrowing of carotid artery, or lipid profile increases, or homocysteine is also increases. So for how to treat, we do the dual antiplatelet therapy, tablet aspirin, dose is 300 milligram, or plus tab clopidogrel 300 milligram. Uh, tab aspirin from next day 75 milligram, and tab clopidogrel from next day 75 milligram. We decrease the dose from 300 milligram to 75 milligram. Then also we add the atorvastatin. We also give vitamin B6, B9, or B12. Then a novel oral anticoagulant also we have to give the patient, that is a factor 10 inhibition is rivaroxaban or dabigatran, that is direct thrombin inhibitor. So that's all about transient ischemic attack.